Hello friends. Today we are going to discuss about Autism Spectrum Disorder Disability Assessment 2024. I am Dr. Suresh Padadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about the Autism Spectrum Disorder Disability Assessment, which was notified by the Government of India on 14th March 2024. In this video, I'll also be focusing on how to do the assessment, what are the tools required, and when to do the assessment. And also, I'll be critiquing about this instrument which was notified. On 14th March 2024, the Government of India notified various disability assessment, including autism spectrum disorder. In this regard, there was an important committee formed, that Subcommittee on Developmental Disorder. This committee was headed by Dr. Shifali Gulati from AIMS, New Delhi as a chairperson, and various other people from various fields were included. Invariably, there was only one psychiatrist in the subcommittee. Now let's understand how the autism spectrum disorder has been defined as per this Gazette notification. This Gazette notification also defines autism spectrum disorder is a lifelong neurological condition typically appearing in the first 3 years of life that is marked by pervasive impairment in the areas of social, skill, and communication, often associated with hyper or hypoactivity to sensory inputs, unusual interest in stereotypical rituals or behavior, and may or may not be associated with intellectual impairment. Invariably, this definition fits into the DSM-5 criteria which has been laid out by the American Psychiatric Association. That means autism spectrum disorder was defined under the ICD 11 and DSM-5 under psychiatric disorders. Not only that, autism spectrum disorders are well known for comorbid conditions. The commonest comorbid conditions are psychiatric disorders such as anxiety disorder, depression, OCD, behavioral problems, and ODD. If you look at the other behavioral problems from psychiatric angle, disruptive disorder, aggressive behavior, self-injurious behavior. Sometimes they do have sensory disturbance, invariably with regard to auditory, visual, or tactile. And sometimes they may also have seizures, that is epilepsy, and tics. Invariably, 70% of them also have sleep disorders and gastrointestinal disturbances. The more often comorbid conditions are psychiatric condition, and also a significant percent, 20 to 25% of them also have intellectual disability, which is well known. In this regard, this Gazette notification which was notified has listed out the appendices of the guidelines and the tools which needs to be used under the RPwD Act of 2016, which is notified under the page number 522 to 523. I am here mentioning the page numbers also simply because this Gazette notification is height 867 and odd pages are there. That means 800 pages. If you want to look for a specific information, you'll be spending a lot of time. Hence, I'm mentioning the page numbers here. With regard to autism assessment, which is mentioned under 522 and 523, there are two important tools have been mentioned. For the purpose of diagnostic tool, AIMS modified inclined diagnostic tool for autism spectrum disorder, which is freely available and not copyrighted. Similarly, ISA, that is Indian Scale for Assessment of Autism, which is freely available, has been notified. With regard to IQ test, invariably one of the comorbid condition with autism spectrum disorder, Vinland Social Maturity Rating Scale, copyrighted. Mellon's Intelligence Scale, which is for Indian children, copyrighted. Wechsler Scale for children, copyrighted. Binakamer test, again copyrighted. The only which is freely available is NIEPID IQ test. That means if you are using this copyrighted material, you may have to pay, or the patient has to pay for the using this instrument. Further, with regard to, as I mentioned, autism spectrum disorder is also well known to have comorbid psychiatric condition. In such a scenario, you may have to use Indian Disability Assessment Scale, which is IDEAS, which is freely available, not copyrighted. For the purpose of autism spectrum disorder, as I mentioned earlier, you have to use AIMS modified inclined diagnostic tool for diagnosis, which is Appendix 11, which is present in the page number 801. For the assessment of disability severity, you need to use Indian Scale of Assessment of Autism, which is Appendix 12, which is present in page number 846. Let's look into each one of this scale. For the purpose of diagnosis of autism or autism spectrum disorder, as I mentioned, you will be using AIMS modified inclined diagnostics tool for ASD. It has been clearly, as I mentioned, it is based upon DSM-5. So it has two important categories, which is the first category and the second category. The first one is with regard to social interaction and communication, which has three items, and these items are to be mandatorily be present. The first section A1A has social emotional reciprocity, 8 questions. Section A1B with regard to non-verbal communication, 4 questions are there. With regard to A1C relationships, 3 questions are there. All these 3 sections should be positively present before we move forward. With regard to section 2, it is with regard to restrictive and repetitive behavior. Again, which has 4 different domains: stereotyped or speech, 7 questions are there; routines, 1 question; fixed interest, 1 question; sensory symptoms, 4 questions. In the section 2, at least 2 of the symptoms should be there out of 4. Then only the diagnosis of autism spectrum disorder is done. You can use this tool for autism spectrum disorder. It's a checklist which can be used before you diagnose autism spectrum disorder. If you are issuing a disability certificate, before you diagnose, please use the scale to positively diagnose so that you are very clear and it is autism spectrum disorder. Invariably, many of the psychiatrists who have been trained, they know how to diagnose autism spectrum disorder. However, many of the pediatricians across the country in various medical colleges, the posting for psychiatry is hardly 1 month. In such a scenario, invariably they may have to use this tool for diagnosis of autism spectrum disorder. Further, section B has to be utilized to complete the checklist to know whether the child has autism spectrum disorder or not. And name of the assessor, signature, and the date of assessment has to be present. And if you have to make the diagnosis, you will be using this flow chart. A suspected autism spectrum child is brought to you. You'll be administering the AIMS modified inclined tool for the purpose of diagnosis. In the part 1, if the child has all the 3 out of 3 criteria, that means there is a high possibility the child is suffering from ASD. Further, from the part 2, it has to have at least 2 out of the 4 symptoms to positively diagnose as ASD. If it is less number of criterias, that means it is less likely the child is suffering from ASD. Once you have positively diagnosed autism spectrum disorder, now you have to assess the severity for the purpose of quantifying the disability, which is present in the Appendix 12, that is in the page number 846. Here for the assessment of disability, there are six domains have been mentioned. The first domain is social relationship and reciprocity. There are 9 items. Emotional responsiveness, 5 items. Speech, language, and communication, 9 items. Behavioral pattern, 7 items. Sensory aspect, 6 items. Cognitive aspects, items. In total, there are 40 items. Each of these items are to be scored from 1 to 5. Since there are 40, the minimum score is 1. So if you take the total composite score, the minimum score will be 40. The highest score will be 200. That is 40 into 5. So that is how the disability assessment from various items have to be scored. This is the Appendix 12, which is present in the Gazette notification. As I mentioned, it has 6 different domains and 40 items. And you can see the columns, that is score 1 if it is rarely present less than 20%, sometimes if it is present 20 to 40%, score 3 if it is present in the range of 41 to 60%, mostly if it is 61 to 80%, always it is 81 to 100%. That is the score 5 is given. If you look at the ASD, once you get the composite score, and if the child is more than 6 years, then you will be using the disability severity assessment. If the score is between 70 to 106, then you'll be scoring 40 to 59% disability. If it is a moderate autism and the score is between 107 to 153, the disability percentage will be 60 to 79% disability. For severe autism, that is score more than 153, you will be scoring as more than 80%. Invariably here, my dear friends, the Gazette notification gives the range. It does not give the specific numbers, how much it is. So invariably you have to notify the child belongs in the mild autism, scoring between 40 to 59%, or moderate autism, 60 to 79% disability, severe autism, more than 80%. With regard to children below the 6 years, if they are brought to your hospital and they are requesting for a disability certificate, invariably the severity rating scale cannot be done here. Then no severity will be given here. The severity will be based, and by default, the Gazette notification says it has to be notified as moderate autism. Once you have assessed as a autism positive diagnosis, and you will be, by default, you will be giving it as a moderate autism, that is between 60 to 79%. Once the child crosses 6 years, and between the age of 6 to 7 years, re-certification of the diagnosis and also disability will be done. And for the purpose of disability assessment, Appendix 12, ISA scale, page number 846 will be used. For children above the age of 6 years and below the age of 18 years, we will be using Indian scale for assessment of autism for the purpose of disability rating. And you have to redo at the age of 18, and any scales or the assessment used with regard to disability of autism at the age of 18 and above will be considered as a permanent disability certificate. If you look at the validity of the certificate, for less than 6 years of child, the certificate issued will be temporary certificate. Any positive diagnosis of autism will be considered as moderate disability. For the second category, between the 6 years and 18 years, after the diagnosis, you'll be reassessment and recertification by using ISA scale will be done, and based on the disability mild, moderate, severe, you will be giving. Once the child reaches 18 years, the permanent disability certification will be given after again administration of ISA scale. Once the certification occurs after the age of 18, it will be permanent. If you look at the medical authority, invariably the 4 group of professionals are required for signing this disability certificate. The chairperson will be either the medical superintendent, CMO, or civil surgeon. The second person requires is pediatrician or pediatrician pediatric neurologist. The third is a psychiatrist or child and adolescent psychiatrist. Finally, the psychologist, either it is a clinical or rehab psychology. And this Gazette notification, in view of shortage of specialists, the government can hire the private professionals except the chairperson for the purpose of certification. Now let's look into the critique of this autism spectrum disorder assessment. The positive aspect is this Gazette notification clearly lists out the tool, and those tools have been given in appendix. With regard to autism, they are all free of cost, and it clearly says if the person has comorbid mental illness, ideas to be used, IQ scales which has to be used, and it also allows private practitioners can be hired for certifying purpose except the chairperson. The negative aspects: the four professionals are required to issue autism spectrum disorder disability certificate. That means finding four professionals in a single place, invariably it will be medical college or tertiary centers. That means many of the patients and the family members have to need to travel to these medical colleges or else to the tertiary centers. With regard to comorbidity is very common. Ideas for mental illness, IQ for the purpose of mental retardation, and epilepsy has to be done. That means you may have to use multiple diagnostic tools and also the severity assessment to give the disability certificate for a person who is suffering from autism spectrum disorder. Further, they are available only in English and Hindi language. We need to translate into the local language and needs to validate the tool. That means local language adaptation, cultural adaptation has to be done. Although many of the autism spectrum disorder, the NGOs, family members of autism spectrum disorder claim they are neurodiverse people, they are normal. If they consider them as a neurodiverse people, unfortunately, if you don't consider them as a disorder and they are diverse, that means is there a need to give them a disability certificate arises. This is a debate which I had attended a symposium where it was discussed if they are neurodiverse, they are normal people, why the disability certificate has to be given. There is no doubt the current society do not accept the people who are having autistic behavior and also autistic sensory phenomena, and such phenomena are considered are fringe elements and they do not give equal participation and opportunities in the society. There is no doubt the disability certificate has to be given. Unfortunately, many patients and their family members refuse to take the disability benefits which are given for autism spectrum disorders. Of course, it is their choice to utilize or not to utilize. Here in the government of India and the various states have offered the disability certificate for autism spectrum disorder. To conclude, my dear friends, this Gazette notification is very comprehensive, more than 800 pages. It is somewhere around 867. We need to train all the government DMHP officials, psychologists, social worker, and psychiatrist in assessment of autism, both AIMS modified, incline, and ASA tool, so that they can certify the patient and they get the disability benefit. However, these tools need to be translated into the local language and adapted. Although they are neurodiverse people, but they require support, equal opportunity, and disability certification so that they can participate in the mainstream of the society. Thank you very much for giving your valuable time. Stay safe.